Thank you, Austin. Right now we turn to a digging deeper story, and we are looking at why doctors say having a primary care provider is more important than ever, especially in rural communities. From rising healthcare costs to crowded emergency rooms, one area family shows how a long-term relationship with a provider can shape both health outcome and access to care. Our very own Crystal Flintrop has that story.
In Prairie du Chien, 6-year-old Tinley Shaw doesn't dread the doctor's office. It's routine, familiar, and built on trust.
We have actually had Rochelle as our primary care physician for almost 13 years at this point. We had her with my son and then continued on to when we had her. She did have a lot of medical issues during my pregnancy when she was born, but Rochelle has just always been there along the whole way with us.
That relationship is at the core of primary care. A place to go before a problem becomes a crisis.
We're addressing health maintenance as well as disease prevention, and then taking care of people who have disease states and trying to get them into the best possible health that they can be. Kind of like, maintenance on your car. You have to do that maintenance on yourself in order to kind of stay healthy.
And in Prairie du Chien, primary care also means coordinating care, especially when specialists are further away.
In the rural area, we really manage a lot of people's health problems. So we do the preventative things with the screenings, as well as manage their diabetes and high blood pressure and heart disease. And then we can, I kind of feel like we're like their coordinator, and then we can refer people out or to La Crosse if needed. So it is good to have a primary care provider in the rural area, just because it's an hour and a half to get to La Crosse.
But providers say more patients are skipping primary care altogether and heading straight to urgent care or the emergency room because it feels faster.
There are patients who just find the ease of going to the emergency room, whether it's appropriate or not, easier than coming in for a scheduled appointment. It's disappointing when that happens because we can do that care for a non-urgent issue that doesn't need to be, treated in the emergency room, but a lot of people just do.
That convenience can come at a cost, both for patients and for the healthcare system.
A lot of times when you go to an urgent care setting, they're thinking more about an emergent problem, and so sometimes you can have more of a workup than maybe you would need. The emergency room bill is potentially going to be higher than it would be if you just came to us in primary care.
For the Shaws, having a provider they can message, someone who knows their history, can help prevent unnecessary visits and unnecessary bills.
It's that ability for us to be able to just send in a quick message and say, hey, this is happening. Does it warrant a visit? Is there something we should try over the counter?
Nisha says the biggest savings may not show up on a single bill. They show up years later when screenings catch problems early.
If we find breast cancer early, that could lead to less testing. Maybe we've caught it at a stage 1 where it can just be removed and you don't have to have, the radiation and chemotherapy. Whereas if you wouldn't have done that mammogram, maybe it wouldn't have been caught until later, and then your cost of that care is going to be definitely higher.
Reporting in Prairie du Chien, I'm Crystal Flintrop.
Thank you, Crystal. Well, doctors say most insurance plans cover primary care visits and preventative screenings. Patients can establish primary care by calling their local clinic or using online patient portals like MyChart.